Hello, folks. This is Dr. Michael Revere, owner of eartrim.com, and I'm here to give you personally aftercare instructions. In other words, what do I do with my dog when I pick him up from his surgery? Well, the number one thing that you have to keep in mind is we have to prevent the number one enemy of the healing of an ear crop, which is the dog's desire after he wakes up from his surgery from shaking the head. Every dog, no matter how old they are, is going to want to shake, shake, shake 24/7 because his ears are bothering him a little bit. In the old days, before super intense pain medication came along, we would instruct our owner to give just a simple drug like carprofen on a regular basis, which is a painkiller. But carprofen doesn't totally eliminate all the discomfort. So the dogs would still want to shake their head. We would tell the client, please stop him from shaking their head with your hands. The funnels that we give you, included in your price, do a good job as far as stopping him from scratching his ears, but it doesn't do a good job at all as far as just shaking the head. So we would tell our owner, if you want to get an ear prop, you're going to have to stop the dog from shaking the head by staying with your dog 24/7. So the number one way we offer for you to stop the dog from shaking the head is to just stay with your dog night and day. Now, there's a better way to stop a dog from shaking the head, and that is to offer him super intensive pain relief. I just got back from one of the largest pain management programs from the Veterinary Anesthesia Society that I've ever been to, and they taught me that you can give 3 different drugs to an ear cropping dog or any dog that's painful for any reason. And when you give different safe drugs given together, they act synergistically. In other words, tramadol by itself may not be that great of a painkiller, but when you combine it with other drugs, it becomes very good. And so we know now how to give these 3 different drugs. We call it the super intense pain medication program. Now, this super intense pain medication program costs extra, but I would advise getting it because we have seen some dogs, in fact, most dogs, have so much pain relief that their head shaking is down by 90%. And that allows you to where you don't have to watch them so carefully. You get sleep at night, and the dog, more importantly, the dog heals quicker. So, one, you can stop the dog from head shaking the old-fashioned way, which is staying with him night and day. Give him a simple pain reliever and just stay with him night and day for 2 weeks with your hands stopping him from head shaking. Or 2, you can do things what I consider the better way. Give him super intense pain relieving drugs. It makes the dog feel like he's not even had an ear crop, and he eliminates the head shaking, and everybody wins because the dog heals quicker that way. There's a third way to stop for you to cope with the dog after you've gotten him from his surgery, and that is to board him with us. We have one of the most modern boarding facilities in Houston. We have the capability of watching your dog, not 24 hours a day, but very carefully. We keep them in beautifully comfortable, isolated cages. Every dog's in his own cage in a very, very comfortable air-conditioned room. Every dog is on their little comfy pad, which gets changed 5 or 6 times a day. They get the VIP care, basically. And we are here to take care of any problems that arise, including your daily price. The price of a boarding to board a dog, as of the is $45 a day. So if you can do that, and you just don't have time to watch your dog carefully for the 2 weeks following his ear crop, consider boarding as an option. We offer it. We're very good at it. And most importantly, the doctor and team that did your ear crop is right there watching your dog as much as we possibly can until he heals. Now, going back to the super intense pain medication program, I do want to go over how that works. Basically, you'll be putting your dog on 3 different drugs, which we carefully go over with you how to use. And I want to go over with you what the ideal situation is for those drugs. One, if you decide to go with the super intense pain medication, you have to realize that you'll be giving those like clockwork every 6 hours with a little bit of food. Now, after a day or 2, if you notice that your dog's appetite starts to fall once he's on the super intensive pain medication, surely he is not head shaking, he's feeling comfortable, but his appetite is not what it used to be. That's a sign that maybe the super intense pain meds are a little bit too high for your particular dog. And I want you to stop the super intense pain meds at that point completely and let him rebound until he starts eating again. and then call me back up once he starts eating again, and I'll lower the dosage. Now, if you see the opposite effect while you're on the super intense pain meds, that your dog is still head shaking, he's eating well, he's active, but he's still head shaking too much. And too much is defined as 2 head shakes per minute. He should really be so comfortable that he's only head shaking maybe 1 time a minute, but if he's head shaking, 10, 15, 20 times a minute, of course, that means that he's not under enough pain meds. And every dog's body is different. Some dogs require a little higher dosage. So if you notice that he's eating well, but he's still head shaking too much, then you call me up and I will raise the dosage. We have to adjust the dosages on some of these dogs. The ideal situation when he's on a super intensive pain meds is that he is active. He will not be sedate. He will be fairly active, playful. He will be eating extremely well, but he just should have the head shaking very, very minimal, hopefully 0. Many of our dogs on the super intense don't head shake at all, and this allows their ears to heal so much quicker and better. So please remember that about the head shaking. You can do things the old way, which is stay with your dog night and day and stop him with your hands, which we don't particularly like that method, but some of our customers prefer that. 2, my favorite way, which is stopping him from head shaking with a super intense, super safe pain medication program, albeit watch for the danger signs that I just mentioned. Or 3, just make it easier on everybody involved for our financially comfortable customers and just board the dog with me. And I do all the hard work. I give him his pain meds. I take care of every little problem that comes along at no additional cost while he's boarding with me. And when you pick him up in 2 weeks, our goal is that he's completely healed and ready to go home, and you almost don't have to do any work after that. All right, so we're going to move on to what do you do other than stopping head shaking when you pick up your dog, and that is you are to get ready to come into me every 3 days. When you pick up your dog from his ear crop, you have got to come into me every 3 days for his $15 visit. That's right, it's not free. He has to come in for his bandage changes every 3 days. I have to make sure that his ears are clean to perfection. I have to make sure that he is in proper stretched tapes and his ears are in just the right position for the proper straightening process so his ears look good when we're finally done with the ear crop. So you'll be coming into me when you pick up your dog from his ear crop. Get ready to come into me every 3 days for 2 weeks. Now remember, I am closed on Tuesdays. I'm going to go over my business hours right now with you, and I want you to write this down. Monday, I am open from 8 a.m. to 3 p.m. Tuesdays, I am closed. Wednesdays, 10 a.m. to 8 p.m. Wednesday, again, 10 a.m. to 8 p.m. Thursday, 3 p.m. to 8 p.m. Friday, 3 p.m. to 8 p.m. You notice on Thursday and Friday, I'm not open at all during the morning. I don't open until 3 o'clock in the afternoon. From 3 p.m. to 8 p.m. on Thursday and Friday. Saturday, 8 a.m. to 3 p.m. Sunday, 10 a.m. to 3 p.m. And again, Monday, I am open from 10 a.m. to 3 p.m. Please remember those business hours because I do not want you to drive to me on a Tuesday, for example, when I'm not open, or a Thursday or Friday morning when I'm not open. Write down those business hours. Consult eartrim.com, my website, or look for the text that we've sent you already to your phone that go over all of our business hours, etc. Okay, so remember this. When you pick up your dog from your crop, there's 2 things to remember. I can't have any head shaking, and I have to see my dogs every 3 days so I can make sure they're doing well and monitor them carefully. I'm the doctor, they're my patient. I have to take care of them. And then at the end of 14 days, hallelujah, the day has arrived where we get to take the sutures out. That's a $29 visit where I put the dogs under tranquilizer, remove all of his stitches. By the way, our stitches do not absorb. In my opinion, anybody who would use absorbable stitches on an ear crop, that's not the best idea because the stitches absorb by inflaming the ears, and that's not what we want. So we're going to try to cause the least amount of inflammation to the ears as possible. That means we use non-absorbable stitches that have to be removed by hand on day 14. That procedure costs $29. Okay? So get ready to come in. Now, if you're from a faraway land like Austin, Dallas, Fort Worth, the Valley, Arkansas, Louisiana, we get people from all over. You don't have the luxury of coming to me every 3 days. Ask us to send you people in your area that are experienced with taping that can help you out. It's not as good as me being there, but it's the next best thing. You've got to promise me one thing. It is not my fault you have decided to drive into me from a faraway place for our incredible ear crops. I don't want you to call me up on the phone and say, Dr. Revere, my ears are all inflamed. What do? I'm 4 hours away. I'm sorry, I'm going to tell you to drive into me. I do not have confidence that other doctors know how to handle ear cropping problems as well as I do. Maybe they do, but very few people know how to handle ear cropping problems anymore because ear cropping is a dying art. They don't teach ear cropping in veterinary schools. In fact, it's very badly frowned upon. So you're not going to find too many young or modern vets that really know squat about ear cropping. Please come into me. Let me finish what I started if you have problems, no matter how far you have to drive. If you can't, then the risk is on you, folks. Okay? So anyway, that's the aftercare instructions. It's very simple. I don't want head shaking, and I do want to monitor my dogs for the first 2 weeks very carefully every 3 days to make sure they get through the process correctly. If you do that, everything should be fine. I'm one of the few doctors out there that answers his own phone 24/7. Okay? So if you have any questions, feel free to call me at 713-818-7956. I know that ear cropping can present many issues. That's why I'm here for you to answer your questions at all times. Now, please consult the video we give you, this video, that goes over all the instructions on how to take care of your dog before calling me. But if you still have questions, feel free to give me a call. So thanks again from eartrim.com. This is Dr. Mike Revere. Have a wonderful day. If you have any questions, give us a call. This is the video I'm going over the aftercare, and we wish you all the best of luck. Thanks again.